If you do anything for yourself this month, get your heart checked. Heart health is the most important factor in living a long life. What you should be asking your doctor and what you can change in your life right now to keep your heart healthy.
Bryce, in dealing with patients as a natural health expert, do you find we don't focus enough on our hearts?
Well, that's a great question. You know, what might shock you to learn is that every 7 minutes, somebody is having a heart attack or stroke. So clearly the numbers show that we're not taking care of ourselves and certainly not as heart-centric as we should be.
So what should we be doing?
Well, we've heard this age-old rhetoric. It's probably tiring for some folks. Exercise more. You want to make sure you're eating cleanly. And of course, what that means is ditching the carbs and going towards the fruits and vegetables, all the colors of the rainbow every single day. But to that, I would add that we should be meditating. Get mindful. Now, 10 or 20 minutes every single day to get yourself calm and relaxed, that's going to help your heart, okay? And to that, there's some proven scientific value in taking an 81 milligram aspirin every single day. To that, I would also add an omega-3 fatty acid. Science is incredible to support the heart and as well the brain. And then to add to that, garlic. Eat more garlic in your diet.
I like that part especially. Obviously, it's not a one-size-fits-all solution, however.
Well, it isn't. And the reason is we're all unique. I mean, we get what mom and dad deal us in terms of our DNA, and that sort of forms who we are. And that is actually accessible in the form of functional ranges. We should be looking at that and getting testing for that.
So it's possible that we could have a heart issue and not even know it.
You know, in fact, 50% of heart attacks are silent. And ultimately, we're not even thinking about this until we experience symptoms. We need to be proactive, not reactive.
How do you be proactive?
Well, and that's a great question. We need to get tested. Assessing yourself to determine what kind of individual you are and what your risks are, I would look to things like LDL and HDL. This is cholesterol, okay? And LDL, think of that as the lousy cholesterol. HDL is the good cholesterol. Triglycerides, your doctor's spoken to you about that as well. Think about that as a piece of white bread with butter and sugar on top of it, fatty sugar. It's horrible for you. You don't want that in your blood. And then to that, C-reactive protein. That's an inflammatory marker. We should check that because the correlation to the heart and your heart health, and even risk for heart disease and stroke, as we're talking about, is extremely correlated.
Inflammation in the body is bad.
Bingo. Inflammation is a medical buzz term of the day for a very good reason. We don't want it. A little bit's okay, but too much, heart disease. And that's what warrants that lousy cholesterol to attach itself to the inside lumen of your artery lining. That means heart attack.
There is a takeaway, however. We don't have to be scared of our hearts.
No, absolutely. I think acting proactively and getting assessed and really acknowledging that we're not taking care of ourselves as we should and doing something about it, even that act of being proactive is extremely healthy.
What's the big takeaway?
Well, you know, so there's all these things that we can do to be proactive, and I think that's key. Test yourself, eat the right kind of diet, as we all know, and exercise more. I mean, these are the three big takeaways. But you know what? The Japanese call this ikigai, and this translates into sense of purpose in life. So here's my call to action is take care of your heart by finding your heart's purpose. When you find that, it is the common denominator that runs across all populations that live beyond 100. We call them centenarians. So you want to live a longer, healthier life with a healthier heart? Find your ikigai.
For more information about your optimal health and getting tested, log on to myhealthreport.ca.